Hello, everyone. This is Francine Crawford. I am your host of Autumn is Here. Today is October 15th, and today is actually Medicare Annual Enrollment Day. And we have a representative from MJHS who's going to talk to us about Medicare. He is the Senior VP of Health Plan and Growth at Elderplan. Please get ready, take some notes, because you're going to get a lot of great information. Autumn is Here. Hello, everyone. Welcome to Autumn is Here. Today we have a guest, Frank Polanco, and he is with MJHS, and he is the Senior VP of Health Plan Growth in the Elderplan. So please welcome Mr. Polanco to the show.
And thank you, Francine. Thank you very much for having me on your show. I was watching, I've watched a few of the episodes, and I think what you're doing is fantastic. This education needs to get out there, and it's a pleasure for me to be here with you today. Like you mentioned, my name is Frank Polanco. I'm the Senior Vice President of Health Plan Growth at Elderplan. Elderplan is a not-for-profit health plan based in New York. It's a member of the MJHS Health System. I started here back in 2008, and I support a team of over 70 people who are out in the community educating prospective members on their health plan options.
Okay, so that's what Elderplan is? Were you educating older people on their healthcare options?
Yes. We are a managed care plan. We are, some people might call it an HMO, a Medicare Advantage HMO. And our people are out in the community educating and enrolling people, when it's appropriate and it suits their needs.
Okay. So let's talk a little bit about Medicare and Medicaid. Can you?
Okay. Yeah, absolutely. Medicare, Medicaid, two completely distinct entities. Medicare being a federal entity, Medicaid being a state entity that does get some federal funding, but it's a state entity, is run by the state, and each state has one. But Medicare is the federal government's insurance program for people aged 65 or older, regardless of their income, regardless of their medical history, regardless of their health status. And Medicare is also available to people under the age of 65 who have certain long-term disabilities. Now, Medicaid is a state program that's available to people in the state based on their income and their medical necessity.
Okay. So right now there's an annual election period. Can you explain a little bit about that?
Yeah, the annual election period is a big deal. The Medicare annual election period, it starts on October 15th, so it's right around the corner, and it ends on December 7th. And during this period, anyone that has Medicare can change the way they receive their Medicare health plan and prescription drug coverage to meet their needs. So, like I said, it's a very important time because plan coverages, costs, and networks that participate with these plans change every year. As an example, here at Elderplan, we've improved our benefits and we've added a point of sale option, which allows our members to see the specialist of their choosing. So everyone is making changes, and it's very important for the consumers to shop. And this is the time of the year to do it. Kind of like in November when you have Black Friday. The AEP is the Black Friday of Medicare.
Okay, that's a good way to think about it. So what are 4 things that people should, think about when they're going to choose which plan or what they should do with Medicare?
The most important thing when you're thinking about Medicare, when you're thinking about a Medicare Advantage plan, there's, I would say, 4 important things. And we can start, and this is no particular order, but we can start with making sure that your doctors are in the network. You want to, especially older adults, you want to make sure that the doctors that you feel comfortable with are in the network. Your primary care physician, all your different specialists, whether it's your cardiologist or whatever it is that's important to you, need to make sure that those doctors are in the network. It's also important to understand how much you're going to pay for your medications. Are your medications covered by the plan in the manner in which you're accustomed to receiving it? Are you able to pay $5, $1, $20, whatever it is that you would have to pay for your medications with that health plan? Those are things that vary from plan to plan. How much is it going to cost you to see your doctor? Are you accustomed to paying $5 as a copay, and now are you going to have to pay 10? Or if you're accustomed to paying 10, is there an option where you could pay 5? So how much are your premiums and your copays in this new plan that you're looking at? And what's wonderful with Medicare Advantage is that Medicare Advantage offers additional benefits. So what are the additional benefits? You know, a lot of older adults that are in Medicare Advantage plans now, OTC has become a big thing where they get a card and they could buy some over-the-counter items with their card, or sometimes people can buy groceries. You know, Elderplan offers an OTC card where you can buy groceries. It can help you with your rent payment. So it's very helpful. So there's also additional benefits around hearing, around dental. Can you get preventive or can you get comprehensive dental? And Medicare.gov, the government's website, offers a really good tool to help with these comparisons. If you go to the Medicare.gov site and you enter your zip code and you answer some simple, kind of like drop down questions, it'll help you narrow down the options that are in your area and give you some cost comparison so that it can help your decision-making process.
Okay, so that's interesting. So when people, sometimes you get a prescription from a doctor and it's not the generic kind. And when you get to the pharmacy, they said something about, well, you can get the generic kind. And the Medicare, is there a choice or is it only for generic kind? Do you know?
No, there's absolutely a choice. And whenever you enroll in a Medicare Advantage plan, some of the materials that you receive a provider directory that lists all the doctors, and you also receive a formulary. And this formulary is a listing of all the drugs. And those formularies could come in hard copy or they could be listed online. And it's very important to understand the drugs that you take and to look in that formulary, and you could see whether the brand that you're interested in receiving is in the formulary or whether the generic version is in the formulary. And with Medicare Advantage, you'll find both, but that's why the shopping process is so important.
Okay. So is it possible for them to switch companies before the year's out, or is only this annual time?
Well, I would like to give you, a clear answer to that question. And yes, you can switch. And now is the time to switch, right? Between October 15th and December 7th, if depending on what your shopping process looks like, you can make that choice to switch plans. If you make that choice between October 15th and December 7th, the plan that you've chosen based on your needs will be effective on January 1st of 2024. And the plan that you were previously in will disenroll you automatically on December 31st of 2023. So you don't have to worry about the old plan. Right. Once you enroll in the new plan, all that would happen automatically. Now, a word of caution, Francine, and I think this is very important for your listeners. A lot of our senior citizens who are just retiring have either with themselves or with their spouse some union coverage or maybe some employee coverage that goes along with their Medicare Advantage plans. I know my parents had a similar situation. Now, if those folks, want to switch plans, it's very, very important that they check with their health plan administrator to make sure that there aren't any benefits that they could lose. Because if they were to enroll in a new plan, they would lose those benefits forever, even if they switch back to the old plan. So it's very important. So yes, the answer is yes, they can switch plans. They should make sure that there aren't any benefits that they would lose if they have some kind of employer coverage or union coverage.
So if this is the open enrollment period, so if they were to miss that, then they just stay in their plan that they had previously? Is it automatically roll over?
Well, generally speaking, if you're currently in a Medicare plan and you do not elect to make a change during this AEP period, you will have another opportunity to make a change between January 1st and March 31st. This is called the open election period, or OEP. And there are a few special elections beside that would give people more options. And I'd love to talk about that, but maybe we could do that on the next time you invite me on the podcast. It's a lot to unpack there.
Okay. So as far as long-term health plans, like, do you have any suggestions for what people should look at for long-term health plans?
Long-term health plans really are separate from the Medicare program. Okay. And again, there's a lot to unpack there. There are private long-term care plans that you can purchase, and you can pay a premium. And in the state of New York, there are a lot of there's a program called Managed Long-Term Care, which requires folks to have full Medicaid in order to enroll in that program. It requires an assessment. But if you're thinking ahead and you want to think about long-term care, there are several private companies out there who offer long-term care insurance plans. It's not that different than going out and buying a life insurance policy, whether it's term life or whole life. You would go out and buy a long-term care insurance plan and pay a monthly premium.
Okay. So this information is accessed through what? How would they get information on this? Or people who support even not only the person that's enrolling, but their support system. If they have a caregiver or somebody, how do they get information on this to know how to do this?
Well, I think a great resource is Medicare.gov. Medicare.gov has all the information on enrollment periods, has the comparison tool where it will give you every single plan option in your area. And right now, there are a lot of people in the community that are out there talking about their health plans and are willing to give you some education about what they have to offer. But I think the most objective tool that I've seen out there is at Medicare.gov, the Plan Compare tool. And it really gives the beneficiary or the prospective member a really good understanding of what the options are in their community.
Okay. Well, thank you. Is there anything else that you think that the audience should know about Medicare? Anything you would like to say or that would help them?
Well, I think that everybody who receives Medicare and has chosen Medicare Advantage, everybody should know that the plans change every single year. And folks really do have an opportunity to take a look at a bunch of different offerings and realize what's best for them. There are many, many quality offerings out there that are zero premium. They don't have to pay a premium. There are offerings that offer, like I mentioned earlier, OTC, $100, $200 per month to help them with some over-the-counter items. There are plans that offer comprehensive dental. There are plans that help you pay for your glasses. So there are a lot of options, and I encourage older Americans to go out and look at all the plan options and make sure that they change every year, because the plan that you had last year and worked so well, they could be reducing benefits. They could be raising benefits. It really is important to do your research and to shop every year for the option that best suits you. And this is the time to do it, from October 15th to December 7th.
Okay. Thank you. That is such helpful information. I really appreciate that. And I'm sure that people, they may not know. And then I'm glad that you gave the range of day, because I thought it was October 15th in a short period of time, but it's still October till December. So you're able to look at different sources and different resources and what plan fits you best. I think that's the point. Yeah,
exactly. And the plan that suits you best, might not be the plan that suits your husband the best. So, I think as a family, each individual needs to make sure that their needs are met. It's not always, just because, I'm in Elderplan, will Elderplan be suitable for my wife? I think everybody needs to really look at the plan offerings, consider what we talked about earlier, the doctors, the medications, all the costs and the additional benefits, and just make sure they understand what works for them. Even gym, a lot of these plans offer gym memberships also. Maybe someone in the couple is more active than the other, but these are all additional offerings that health plans offer.
Oh, okay. Awesome. Well, thank you so much. I really appreciate you coming on and giving people this information and just taking the time just to help out our older adults, because it's very important. It's very important. And it's a lot when you're retiring and things like that. There's a lot of things that you have to have information on. So I thank you for kind of helping them to streamline this a little bit. So I really appreciate you coming on. Thank you again.
No, thank you, Francine, for creating this forum and allowing folks to come on and give this information. I appreciate it. Thank you, and keep up the great work.
Oh, okay. All right. Take care. Bye-bye.
Bye-bye now.